Proceed.
Honorable Speaker, I beg to give notice of the following motion, that this House does adopt the report of the Committee on Lands, Physical Planning, Housing and Urban Development on the Olkalau, Engineer and Mailunya municipalities, solid waste management policies and solid waste management plans as a report of the House on the and the recommendation therein as resolution of the House. Thank you, Mr. Speaker.
Honorable, you may proceed and give notices of the other motions.
Honorable Speaker, I beg to give notice of the following motions, that this House does adopt the report on the Committee on Lands, Physical Planning, Housing and Urban Development on the Olkarau, Engineer and Mailunya Municipality Risk Management Policies as a report of the House and the recommendation therein as the resolution of the House. Number 3. Honorable Speaker, I beg to give notice of the following motions, that this House does adopt on the Olkarau, Engineer and Mailunya municipalities asset management policies, asset register and maintenance plans as a report of the House and the recommendation therein as resolution of the House. Number 4. Honorable Speaker, I beg to give notice of the following motion, that this House does adopt the report on the Committee on Lands, Physical Planning, Housing and Urban Development on the Olkarau and Engineer municipalities, urban climate risk profiles as a report of the House and the recommendation therein as the resolution of the House. Honorable Speaker, I beg to give notice of the following motion, that this House does adopt the report of the Committee on Lands, Physical Planning, Housing and Urban Development on the Private Sector Engagement Framework, PSEF, and Municipal Private Sector Diagnostic Tools as a report of the House and the recommendation therein as a resolution of the House. Number 5. Honorable Speaker, I beg to give the notice of the following motion, that this House does adopt the Committee on Lands, Physical Planning, Housing and Urban Development on the Olkarau Municipality IDEP 2026 to 2031 and the Engineer Municipality IDEP 2025 to 2030 as a report on the House and the recommendation therein as a resolution of the House. Number 7. Honorable Speaker, I beg to give notice of the following motion, that this House does adopt the report on the Committee on Lands, Physical Planning and Housing and Urban Development on the Olkarau and Engineer Municipality Pre-Feasibility Studies and Municipality Investment Plan as a report of the House and the recommendation therein as a resolution of the House. Number 8. Honorable Speaker, I beg to give notice of the following motion, that this House does adopt the report on the Committee on Lands, Physical Planning, Housing and Urban Development on the Olkarau, Engineer, Mailunya municipalities, municipal grievances and redress mechanism system as a report of the House and the recommendation therein as a resolution of the House. Number 9. Honorable Speaker, I beg to give notice of the following motion, that this House does adopt the report on the Committee on Lands, Physical Planning, Housing and Urban Development on the Olkarau, Engineer and Mailunya municipalities Gender Inclusion and Participation Framework as a report of the House and the recommendation therein as a resolution of the House. 10. Honorable Speaker, I beg to give notice of the following motion, that this House does adopt adopt the report of the Committee on Lands, Physical Planning, Housing and Urban Development on the ISUD for engineer municipalities as a report on the House and the recommendation therein as the resolution of the House. 11. Honorable Speaker, I beg to give notice of the following motion that this House does adopt the report on the Committee on Lands, Physical Planning, Housing and Urban Development on the Olkarau, Engineer and Mairuenya municipalities, urban area funding criteria as a report on of the House and the recommendation therein as the resolution of the House. Thank you, Mr. Speaker.
Very well. The notices of motions are duly given, and the same shall be processed as directed by the House Business Committee, pursuant to Standing Order 157-5D. Next order.
Order number 7, statements. Order number 8, motions and bills. Mr. Speaker, sir, we have a procedural motion to be moved by Honorable Duncan Gethenji Chege, Chairperson, Committee on County Public Accounts and Investments.
Honorable Duncan Gethenji Chege, Chairperson, Committee on County Public Accounts and Investments. Proceed.
Mr. Speaker, sir, I beg to move the following motion that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Account and Investment Committee on the report of the Office of the Auditor General on the Engineer Sub-County Hospital for the year ended 30th June 2025 as the report of the House, and the recommendation therein as the resolution of the House be exempted from the requirement of the Standing Order 50 that require notice of the motion be given at least 1 day before the motion appear on the order paper. And Mr. Speaker, I ask Honorable Mheshimiwa Kadogo to second.
Order, Honorable Gethenji, can you refer the member to official names?
Gethenji.
Would remind Honorable Dan Gethenji, Honorable Lucy Gethenji, and I second the motion.
The motion is duly moved and seconded. I propose the motion that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Engineer Sub-County Hospital for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House be exempted from the requirements of the Standing Order 55B that requires a notice of motion be given at least 1 day before the motion appears on the order paper. I now put the question, which is that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Engineer Sub-County Hospital for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House be exempted from the requirements of the Standing Order 55B that requires a notice of motion be given at least 1 day before the motion appears on the order paper. May those of a similar opinion say aye. May those of a contrary opinion say nay. And the ayes have it. Clerk, next order.
Still under the order on motions, we have a substantive motion to be moved by Honorable Duncan Edenji Chege, the Chairperson, Committee of County Public Accounts and Investments.
Honorable Duncan Edenji Chege, Chairperson, Committee on County Public Accounts and Investments. Proceed.
Thank you, Mr. Speaker. Mr. Speaker, allow me to move the following motion. Report of Committee on County Public Accounting and Investment Committee on report of the Office of the Auditor General on Engineers Sub-County Hospital for the year ended 30th June 2025. Mr. Speaker, let me start with the acknowledgement. Mr. Speaker, the Committee on County Public Accounting and Investment wishes to express its appreciation to the Office of the Speaker and the Clerk of the County Assembly for the support and facilitation provided during the examination of the Auditor General report. The committee also appreciates the Department of Health Services for availing the requested information and appearing before the committee to respond to the audit query. Special appreciation goes to the honourable members of the committees and Secretariat for the commitment, dedication, and professionalism throughout the review process. Finally, the committee acknowledges the role of Office of the, finally, Mr. Speaker, the committee acknowledges the role of Office of the Auditor General in promoting accountability and transparency in management of the public resources. Mr. Speaker, we come to the committee's background. The County Public Accounting Investment Committee is elected committee established under Standing Order number 190 of the County Nyandarua County Assembly Standing Order. The committee is mandated to examine the account showing the appropriation of funds voted by the Assembly to meet the public expenditure and examine the report of the Auditor General on county government entities. The committees also examine whether the public resources have been utilized in accordance with the law and whether the public entities are managed in accordance with the sound financial and commercial practices. In excess of its mandate, the committee reviews report of Auditor General and makes recommendation to the Assembly on measures necessary to improve the accountability and financial management within the county's government institution. Mr. Speaker, I come to the mandate of the committee. 1. Examine the account showing the appropriation of funds voted by the Assembly. 2. Examine report and accounts of county public investment. That's 3. Examine report of the Auditor General on county's entities. 4. Assess whether the public institution operate accordance with the sound financial management principles. Mr. Speaker, allow me to come to the methodology. In examining the Auditor General report of the committee, adopted the following approach. 1. Reviewed the Auditor General report on Engineers Sub-County Hospital for the year ended 30th June 25. 2. Requested written response from the Department of Health Services. 3, conducted meeting with the County Executive Committee members for the health services and relevant officers. Number 4, received oral submission and supporting documentation. Number 5, analyzed submission together with the auditor report. Number 6, compiled finding and recommendation based on evidence received. I think it's important for me to go through this report on summary of key audit queries, management response, and committee's finding. 1, audit observation. The Auditor General reported increases in the presentation of disclosure and balance in the financial statement, including variance of 1,745,400 in employees' cost. The auditor further established that figures reported in the financial statement were not fully supported by the underlying payroll recording listing concern regarding inaccuracy and reliability of financial information presented. Management response. Management explained that the variance Management explained that the variance arose because note 8 of the financial statement included wages relating to May, June 24, which belonged to the previous financial year but were reported under the current reporting period. Management indicated that the error resulted from the incorrect classification during the preparation of financial statement, and the discrepancy would be corrected subsequent financial report. Management further stated that internal review mechanism would be strengthened to avoid recurrence of similar error. Committee finding. The committee finds that the explanation provided by the management confirmed the extent of weaknesses in financial reporting control, inadequate review financial statement prior to submission for audit. The committee observed that incurrencies in financial statement disclosure undermine the reliability and credibility of financial report and may lead to the misinterpretation of the hospital's financial position. Still, Mr. Speaker, the committee recommendation. The medical superintendent on Engineer Sub-County Hospital shall, within 90 days, institute a formal internal financial statement review mechanism that include reconciliation on payroll recorded with the general ledger and verification of financial disclosure before submission of audit. Further, Mr. Speaker, the County Executive Committee member CCM for financial through the county treasury shall within six months provide technical support and capacity building to hospital finance staff to ensure compliance with the applicable public sector accounting standard. Mr. Speaker, still, we still on long outstanding receivable audit observation. The Auditor General reported a long outstanding receivable amounting to 26,132,092 owed by the National Hospital Insurance Fund, NHIF, and county government. The prolonged outstanding balances concerned regarding the recoverability of amount and hospital liquidity position. Management and response. Management informed the committee that the hospital has been actively following up the outstanding reimbursement and confirmed that NHIF paid that's 4,511,042 in October and November 2024. Management further stated the engagement with the county government were ongoing facilitate settlement of remaining outstanding balance. Mr. Speaker, we come to the committee's finding. The committee found that although the partial payment have been made, the significant outstanding balance continue to expose the hospital to financial strain and negatively affect ability to provide the interrupted health services. The committee also noted that prolonged delays in the settlement of receivable indicate weakness in receivable management and follow-up mechanism. Committee recommendation. The medical superintendent shall within 60 days establish a structured receivable monitoring framework, including monthly reconciliation claim with NHIF and quarterly reconciliation with county treasury. The CCM for health services shall within 90 days engage the social health authority, that's formerly NHIF, and county treasury to develop a settlement schedule for outstanding claim. The county treasury shall ensure that all the verified county obligations owed to the hospital are owed by the hospitals are settled within the next 2 financial quarters. Mr. Speaker, we come to the budgetary control and performance audit observation. Mr. Speaker, the Auditor General reported the weakness in budgetary control where actual revenues and expenditure performance deviated significantly from the approved budget estimate. Management respond. Management attribute to the budget variance delayed disbursement on fund fluctuation in revenue correction. Committee's finding. The committee found that weak monitoring of budget performance undermine fiscal discipline and may lead to the insufficient utilization of public resources. Committee recommendation, Mr. Speaker. The medical superintendent shall within 60 days establish an internal budget monitoring the committee responsible for the quarterly review of budget performance. Beginning the next financial year quarter, the hospital management shall submit quarterly budget performance report to the County Department of Health, County Treasury, and County Assembly Committee on Public Account and Investment. Mr. Speaker, I come to asset management. 3.1. Incomplete property, plant, equipment record. Audit observation. The Auditor General reported that property, plant, and equipment record were incomplete and that hospital had undertaken evaluation of asset. Management response. Management acknowledged that historical documentation for some assets were missing and indicated that plans were underway to undertake the comprehensive asset verification exercise. Committee's finding. The committee found that incomplete asset record represent serious governance weakness that may lead to arrears, misuse, and misstatement of public asset. Committee recommendation. The medical superintendent shall within 90 days undertake the comprehensive verification of the movable and immovable hospital asset and update the asset register accordingly. The updated asset register shall be submitted to the County Treasury and County Department of Health. Mr. Speaker, let me come to number 4, this procurement compliance. Unlimited public procurement capacity building levy auditor observation. The Auditor General observed that the hospital had not limited the public procurement regulatory authority capacity building levy as required under the procurement regulation. Committee's finding. The committee found that failure to limit statutory levies constitute non-compliance with the procurement laws. Committee findings? No, this committee recommendation, Mr. Speaker, sorry. The medical superintendent shall, within 90 days, compute and limit all outstanding public procurement, regulatory authority capacity building levies. Proof payment shall be submitted. Mr. Speaker, we come to human resource management. 6.1, irregular engagement of cashiers workers. Audit observation. The committee observed that the hospital engaged cashier workers on renewable 3-month contract despite the performing core and continuous hospital function. Committee's finding, the committee found that Reliance cashier labor for essential services exposes the hospital to legal and financial operation risk. Committee recommendation. The medical superintendent shall within 60 days submit to the county's Department of the Health and County Public Service Board to comprehensive list of cashier workers engaged by the hospital, indicating their laws and duration of services. The County Public Services Board, in collaboration with the CCM Health Service, shall within 9 months regularize staffing arrangement for the personnel performing core hospitals function. Members, following now in page 15, these on governance and board oversight, irregular constitution and board committees, auditor's observation. The Auditor General reported that hospital board lacked members with financial expertise contrary to mwongozo requirement. This is a committee's finding. The committee found that absent financial expertise undermine effective oversight of financial management. Committee's recommendation. The CCM for Health Services shall ensure that upon the expiry of the current board term, the hospital board is reconstituted in compliance with mwongozo governance guidelines to include at least 1 member with professional accounting or financial management qualification. 7.2, lack of board work plan. The board incurred operational expenses but did not have approved annual work plan. Committee's finding, Mr. Speaker. The committee found that absence of work plan weakness governs oversight and accountability for board expenditures. The committee's recommendation. The hospital board shall within 3 months, develop and approve annual board work plan aligned with the mwongozo's governance guidelines and submit a copy to the county department. 7, failure to conduct the board performance evaluation. Audit observation. The auditor then reported that the board did not conduct annual performance evaluation. Then we come to the committee's finding. The committee found that the failure to evaluate board performance undermines the accountability and continuous improvements in governance. Committee recommendation, the hospital board shall, beginning financial year 2025 to 2026, conduct annual board performance evaluation using mwongozo's compliant evaluation tool and submit the evaluation report to the County Department of Health and the County Assembly within 3 months after the end of each financial year. In conclusion, Mr. Speaker, the committee examined Auditor General report on Engineer Sub-County Hospital, reviewed that significant weakness in financial management, asset management, governance practices, and internal control system. When management has initiated some of the corrective action, several audits remain unsolved and require urgent attention to safeguard public resources and strengthen service delivery. The committee therefore urges the County Department of Health Hospital Management and County Treasurer to fully implement the recommendation and contain this report within the specified timeline. Implementation of this recommendation will enhance financial accountability, strengthen institutional governance, and improve healthcare service delivery to the residents of Nyandarua County. The committee therefore recommends that this House does adopt report of the together with its finding and recommendation. Thank you, Mr. Speaker.
Honorable Rusi Kithinji.
Mr. Speaker, sir, I second.
The motion is duly moved and seconded, and I now propose the motion. I now propose the question that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the J.M. Kariuki Memorial Hospital for the year ended 30th June 2025 as a report of the House, and the recommendations therein as the resolutions of the House. I beg your pardon, honorable members. I propose the question, which is that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Engineer Sub-County Hospital for the year ended 30th June 2025 as a report of the House, and the recommendations therein as the resolutions of the House. Honorable Isaac Kungu, member for Wajohi.
Thank you, Honorable
Proceed.
Speaker. Honorable Speaker, I want to take this opportunity to thank the audit, not the audit, but the PICPAC committee for a very good and very elaborate report. I know the chairman has tried to restrict himself, but he has been able to take us through this report. And I know there is quite some very significant and hard work that has been put to bring to us, to this assembly, this kind of a very serious and technical report to us. I want to sincerely thank the Speaker of this House for allowing this committee to do its work, facilitating them sufficiently. And I know the side of sacrifice they have done, even coming here in the wee hours, coming here even when there are not days of the assembly, to meet and to prepare many reports that they will be tabling, even in the near future in this assembly. Kudos the committee. We say in Swahili, mugara muwe na haki umpe. When they work and when they have put a lot of effort to this, we are proud. Honorable Speaker, sometimes I have been getting very frustrated and disgusted when I sit there in my house and see reports coming out from the Senate. And I may not be able to discuss all of them, but allow me to touch only on 2 or 3 issues. Honorable Speaker, one of the issues that have been significantly been raised by the people of Nyandarua is issue of inadequate stock in our hospitals. So when we see that hospital as a referral hospital as engineer doesn't have a proper way of taking stock, and when they are asked by the Auditor General, they say they have a challenge in storage. I fail to understand all those buildings there. What is this challenge of storage? Is it an issue of a room where to store medicine or the stocks, or is it an issue of software? Because I am thinking as a hospital of that level. This is not a health center. This is not a dispensary. This is a level 4 hospital. a referral hospital for that matter in this county, we are expecting that they have a warehouse, a mean warehouse, where they receive all the stocks, and they have the serious or they have the software where we have the stock in, stock out, and they are able to follow up and to see even how the stocks are being used to an extent that we are expecting they even have a reordering level. So we are expecting they have a warehouse, they have an inventory of how they do it. So when, as a small thing as telling us they have a challenge in storage. Honorable Speaker, I think they don't want to put things right so that our medicine can continue getting into other routes, because there is no accountability for the stock or for the money we provide in the budget to buy stock for our people in Nyandarua. I think telling us there is a challenge for storage is a joke, and a big joke for a referral hospital. The RAD in engineer, it is a serious carelessness. The other day, so much resources to make sure that we have valuation for the RAD for engineer. Finally, so that I allow the members to discuss the other issues. The issue of irregular engagement of casual workers. Another elephant in the room. We have stated in this house, not once, not twice, we need a policy on casual workers. Now, they are telling us that they are engaged in a way that nobody can be able to follow. And I know this is why we lose money. Because we don't know how these contacts are done. At any time, we don't know how many casuals. And that is why we asked the County Public Service Board to come up with a policy to regulate the casuals, how people should be. And I'm also expecting in the near future, in the next report, Honorable Speaker, I have seen that most of the casual workers are engaged on core functions. You get a laboratory technologist who is a casual. You get a radiologist who is a casual. We have passed, this house have passed a ROCAM policy. So I'm expecting we do not see permanent people who are supposed to work permanently working as casuals, because now they have a practice various competencies that they do not have through the ROCAM. So, Honorable Speaker, allow me to stop there, but Engineer Hospital is a very rich hospital with equipment worthy of 368 million. So this is not a facility that we need to joke around. We need to make sure that this institution is modernized, is modeled to a...
Very well. May call the mover to respond.
Thank you, Honorable Speaker, and I call the mover to respond.
Chair, I move.
Julie, point of order
now. Order, Honorable Juliana. The mover is around, so he can proceed and move.
Mr. Speaker, let me first of all congratulate the member for the support, Mr. Speaker, and I move. Thank you.
I now put the question, which is that this House does adopt the report of the Committee on County Public Accounts and Investment Committee, on the report of the Office of the Auditor General on the Engineer Sub-County Hospital for the year ended 30th June 2025, as a report of the House, and the recommendations therein as the resolutions of the House. May those of a similar opinion say aye. Aye. May those of a contrary opinion say nay. Nay. And the ayes have it. Clerk, next order.
Mr. Speaker, sir, still under the order on motions, we have a procedural motion to be moved by Honorable Duncan Githinji-Chege, Chairperson, Committee on County Public Accounts and Investment.
Honorable Duncan Githinji-Chege, proceed.
Thank you, Mr. Speaker. Mr. Speaker, I would like to move the procedural motion. Mr. Speaker, I beg to move the following motion that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Account and Investment Committee on the report of the Office of the Auditor General on JM Karaoke's Memorial Hospital for the year ended 30th June 2025 as the report of the House and recommendation therein as the resolution of the House be exempted from the requirement of the Standing Order 50 that requires a notice motion be given at least 1 day before the motion appear on the order paper. And Mr. Speaker, I still ask Honorable Mheshimiwa Lucy Kithinji as a member of this committee to second.
Honorable Lucy Kithinji.
Mr. Speaker, I second.
Motion is duly moved and seconded. I propose the question, which is that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the JM Karaoke Memorial Hospital for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House be exempted from the requirements of the Standing Order 55B that requires a notice of be given at least 1 day before the motion appears on the order paper. I now put the question, which is that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the JM Karaoke Memorial Hospital for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House be exempted from the requirements of the Standing Order 55B that requires a notice of motion be given at least 1 day before the motion appears on the order paper. May those of a similar opinion say aye. May those of a contrary opinion say nay. And the ayes have it. Clerk, next order.
Mr. Speaker, sir, still under the same order, we have a substantive motion to be moved by Honorable Duncan Githinji Chege, Chairperson, Committee on County Public Accounts and Investments.
Honorable Duncan Githinji Chege, Chairperson, Committee on County Public Accounts and Investment Committee. Proceed.
Thank you, Mr. Speaker. But Mr. Speaker, just allow me to delegate this to Honorable Lucy Kithinji. Kindly, Mr. Speaker.
Very much in order. Honorable Lucy Kithinji, proceed.
Thank you, Mr. Speaker. I'm giving a report of the Office of Auditor General, General JM Karaoke Memorial County Referral Level 4 Hospital for the year ended 30th June 2025. Mr. Speaker, allow me to go straight to the background, Mr. Speaker. Mr. Speaker, the Public Investment Accounts Committee is a select committee established under Order 190 and is responsible for examination of the workings of public investments. The mandate of the committee, Mr. Speaker, is to examine showing the appropriation of the sum voted by the House to meet the public expenditure and such other accounts laid before the House as a committee by the think fit, examine the report and accounts for the public investment, examine the context and the autonomy of efficiency of the public investments, them on oath and receive evidence. Mr. Speaker, The committee is further given. I'll go straight to the membership of the committee. We have our chair, Mr. Speaker, Duncan Gideji, Vice Chair, Juliana Babu Mogola, Lucy Kidinja as a member, Benson Kerry, member, Naomi Ngatia, member, Honorable Esther Waidera, member, Samuel Kayani, member, Honorable Samuel Wainaina Madhu, member, Honorable Patrick Moende Karaoke, member, Honorable Edinard Wambogo Kingori, member, Honorable James Mwangi Geshoki, member, Mr. Speaker. Secretariat, we have Mr. Peter Gishina Karano, Principal Clerk Assistant, Mrs. Alice Nyambura Kemani, Committee Clerk, Mrs. Nancy Washeke Mude, Senior Clerk, Mrs. Patricia Nduta Chege, Clerk Assistant, Mr. John Kainga Kabue, Legal Counsel, Mrs. Christabel Njeri Getau, who is an internal auditor. Mr. Speaker, allow me, I want to presume that the report is in our gadgets. Allow me, Mr. Speaker, to go to the committee. Arose from weak financial reporting processes, inadequate reconciliation procedure, incomplete asset records, and internal reconciliation procedure, incomplete asset records, and internal audit services. Additionally, the persistence of some prior year audit issues indicates that corrective measures have not been fully implemented or institutionalized. While the committee acknowledges the explanation provided by the hospital management and the Department of Health Services, it is evident that stronger oversight, improved financial discipline, and enhanced internal control mechanism are required to ensure full accountability. The management of public accountability for the management of public resources. The committee further notes that the delays in settlement of receivables, budget underfunding, and accumulation of pending bills pose significant risks to the hospital operational sustainability and service delivery capacity. Mr. Speaker, the committee therefore emphasizes the need to urgent implementation of the recommendation contained in the report, particularly those relating to strengthening financial reporting system, improving asset management practice, enhancing revenue reconciliation mechanism, and resolving outstanding audit issues. The County Treasury and the Department of Health Service should also provide the necessary technical and institutional support to the hospital to ensure compliance with public finance management requirements. The committee will continue to monitor the implementation of these recommendations and expects responsible entities to take concrete corrective actions to correct accountability, transparency, and efficiency in the management of public resources at JM Memorial Hospital. Maybe, Mr. Speaker, I would love to look at the recommendations from the committee. Mr. Speaker, I'll go to page 12. Unapproved. Mr. Speaker, let me start from page 11 on committee observation findings and recommendations. Mr. Speaker, number one, the inaccuracies in financial statement. Mr. Speaker, the committee found out that the JM statements, the financial statements of JM Karaoke Memorial Referral Hospital contain several inaccuracies arising from the incorrect application of depreciation and amortization rates and errors in data entry during preparation of the financial statement. These inaccuracies resulted in misstatement of key balances, including the accumulated surplus and depreciation figures. The committee further, Mr. Speaker, observed that the errors indicate weak financial reporting, controls, inadequate review mechanism prior to submission of the financial statement. The lack of robust verification process exposes the hospital to risk persistent financial mismanagements and undermines the reliability of financial report presented for audit. The committee recommended, Mr. Speaker, on the inaccuracies in financial statement, the Hospital Finance Department should develop and implement 3-level financial statement review by 30th June 2026. The checklist should verify depreciation rates, asset balances, accumulated surplus, and note disclosures before their submission to the county treasury. The next recommendation on the same, Mr. Speaker, standardize depreciation and accounting policy. By 31st July 2026, the hospital should adopt a standard asset appreciation policy aligned with public sector accounting standards and approved by the county's treasury. All asset classes should be configured with the correct depreciation rates in the accounting system by the finance department and supervised by AIE order by 30th June 2026. They should also implement a fixed asset management system. The hospital should procure and deploy an automated fixed asset management module integrated with INFIMIS or the hospital accounting system by December 2026. The system should automatically calculate depreciation and generate assets schedules. Number 4 recommendation, Mr. Speaker, beginning financial year 2026-2027, the internal audit unit should conduct pre-audit reviews of the draft financial statement annually before submission to Auditor General, Mr. Speaker. And the last one on that recommendation, Mr. Speaker, on that item is train of all finance staff on NIPAS-based financial reporting and depreciation computation by December 2026. Mr. Speaker, I'll go to recommendation number 3, misstatement of revenue receipts. Revenue from the medical services was misstated in the financial statements. The correct amount corrected was 139,471,864 shillings, but the assessment of comparison of budget and actual amounts reflected 139,046,265 shillings. Management response, Mr. Speaker, they said management acknowledged the error and committed to improving verification. The committee findings on the misstatement of revenue receipts, Mr. Speaker, the committee found that the hospital reported inconsistent revenue figures in its financial statement due to errors in reconciliation of revenue from medical services. The discrepancy between the actual revenue collected and the figures reflected in the financial report indicates weakness in revenue recording and reconciliation process. The committee further observed that discrepancies undermine the integrity of hospital financial reporting to the absence of inadequate revenue monitoring and verification. And the committee recommended on the same, Mr. Speaker, that the Department of Health Services, through the Chief Officer for Medical Service, should introduce automated revenue reconciliation system at JM Hospital by 31st July 2026, implemented by the hospital medical superintendent in collaboration with the county treasury ICT unit. The hospital should conduct monthly reconciliation between hospital revenue records and county revenue funds hospital in month of June 2026, supervised by the Chief Officer for Finance, implemented by the Hospital Finance Department and the Medical Superintendent, AIE order. Mr. Speaker, I'll go to recommendation number 5, and disclosed property, plant, and equipment. The auditor had asked, some hospital assets were not disclosed due to incomplete valuation and asset register updates. And the management had maybe replied to the Auditor General Management, saying that the management had begun capturing land, buildings, and other assets, but the process remains incomplete due to budget constraints. The committee found out, Mr. Speaker, that the hospital had not fully disclosed all its property, plant, and equipment in the financial statement due to incomplete valuation, lack of an updated asset register. Although management indicated that efforts were underway to progressively value the asset, the exercise had not been finalized. The committee observed that the present absence of comprehensive asset register and valuation framework undermines transparency and increases the risk of loss, misuse, and misappropriation of public assets. And the committee recommended, Mr. Speaker, the Department of Health Services and the CECM for Health Services, through the Chief Officer for Medical Services, should conduct a comprehensive asset valuation for JM Hospital by 31st August 2026. The CECM Health Service should maintain a complete asset register, including acquisition dates and values, by 31st July 2026. The CECM should also implement asset tagging annual asset evaluation by 31st August 2026. Mr. Speaker, I'll go maybe to the last recommendation, which is number 7, the audit issue, budgeting underfunding. The hospital experienced budget underfunding of approximately 44% due to an realization of anticipated receivables. The management has revised the budget based on realistic revenue projections. The committee, Mr. Speaker, on the budget underfunding found that the hospital experienced significant underfunding of its approved budget made due to non-realization of anticipated receivables that had been factored in the budget projections. The committee further observed that the reliance on certain revenue sources during budget preparation compromises the credibility of budget process and may affect implementation of programmed service delivery, Mr. Speaker. Mr. Speaker, maybe I'll talk about the very last recommendation about the unresolved prior audit issues. Mr. Speaker, the auditor noted that in the previous years, the audit issues from the previous years remain unsolved, including the unsupported employee costs, weak intervention management, absence of fraud management and risk management policies, and lack of internal audit function. The committee findings, Mr. Speaker, on the same, the committee observed that several audit issues raised in previous financial year remain unsolved. These include unsupported employee costs, weak inventory management system, lack of fraud management policy, absence of risk management framework, lack of internal audit function. And the committee recommended that the county treasurer and the chief officer finance should deploy internal auditor staff to the Department of Health Services by 31st June 2026. Another recommendation, Mr. Speaker, is that the Department of Health Services, through the Chief Officer for Medical Services, should deploy facility-level fraud prevention risk management by 31st June 2026. The Department of Health Services the Department of Health Services, through the Chief Officer of Medical Services, should strengthen inventory management through quarterly stock audit and adoption of automated inventory system. Mr. Speaker, I talked about the conclusion, and I would love to call Honorable Duncan Giveji to second.
Honorable Duncan Giveji Chege.
Thank you, Mr. Speaker. I second, Mr. Speaker. Thank you.
I propose the question, which is that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the JM Karaoke Memorial Hospital for the year ended 30th June 2025 as a report of the House, and the recommendations therein as the resolutions of the House. Honorable Stephen Mureithi Matimo.
Thank you, Mr. Speaker. Mine will be very brief. One, I would wish to really commend the committee because of the report. Mr. Speaker, I think in the morning one of the issues that really came out is the recommendation part. But you find that whatever is here, Mr. Speaker, it has conclusive recommendation to the department. One, Mr. Speaker, I think this is a department that if the few issues that the auditor raised, if they can be able to cover up and ensure that they are able to adhere to what the auditor guided, it's a department that can have almost zero audit query. I think one thing that they need to do is to ensure that they improve on the way they report, because one of the things that has come out is that some of the figures that is appearing in the Auditor General report is typing error from the department. So I think the CCM of this particular department, together with the chief officer, they should ensure that the people in charge of records should report what is right, and the figures that they feed should be accurate, instead of putting figures then after they are asked what is happening, they say that it was a typing error. So that's one thing that the department should ensure, that the record department give accurate information to the auditor. The other one, Mr. Speaker, is on something that I think it has also come up even in this honorable house, about inventory management system. I think, Mr. Speaker, with this, it will be a game changer even to the department and even to the governor himself. At the comfort of his office, he'll be able to know what is happening in almost all of our facilities. And I think with the recommendation that the committee has brought up, I think this is something that we really need to push to ensure that we have an inventory management system. The same will really help us to ensure that if medicine is given from JM Hospital, for example, Mr. Speaker, to that hospital in Gator, we'll be able to know which patient received this medication, so that they can even be called to ensure that for verification purposes. Mr. Speaker, the last one is on unsupported employees' cost. I think these have been a thorn in the flesh.
It's very important even for the hazard and the future to know that this house looked at the report and they were in agreement with the committee on various issues that has been raised. Honorable Speaker, once again, if you compare the report for Engineer Norokarau, you realize that JM has improved significantly. It had 16 issues at Engineer. Here we are talking of 6-7 issues, and they are not very significant issues, telling you that we are heading to level 6. Our JM is a bit more advanced in a way than what we are having in Engineer. You can do the comparison of both hospitals, and you realize the issues that were raised by auditors are totally different. There is some very significant improvement when it comes to JM. But I want to raise some 2 issues here. The issue of waiver. Honorable Speaker, me and you, and even the members know here that we are beneficiaries through our electorate of waiver. Every other month I am there myself claiming for, and I know some Honorable Maureen knows these cases. We are always there telling the superintendent of JM Hospital to give us waiver on behalf of our people, because they have accumulated big fees there to pay. And I agree with the committee, it is important. And the beneficiaries are indigent, they are people who are very vulnerable, but I agree that we need a policy. If you are not very careful, Honorable Speaker, we might put our hospital, JM, and our only referral hospital in a very big danger for cash flow. Because now and then our members will come and tell us we don't have money. Even if you go today, there are so many accumulated issues of waiver. So I beseech that we have a regulation. We beseech we have a regulation. I feel myself and my input on this, Honorable Speaker, the waiver should be given. But also as an assembly, and that is why we want regulation and policy to come here, we should provide money elsewhere, and sufficient money elsewhere, such that when the hospital provides the waiver, it does not lose, because we need services to continue within our hospital. But it can claim this waiver from a certain social fund that is somewhere from the county. Because if we give our people waiver, we need to give our people waiver, they are vulnerable. They can't be able to raise this money. But then we can also kill our hospital. Tomorrow we will not have a hospital to give waiver. So what we need to sit as an assembly and as a county is to agree waiver is necessary. And we need to give waiver. But then how do we deal with it? Let do the application into a different body. If you want a waiver, we have a social fund somewhere. Like I know most of the emergency fund go to waiver to go to paying for the bills. But essentially, money for emergency was not meant for hospital bills. And if you look at that act on emergency fund, you will see that. So I know even the executive go beyond its limit by providing money for emergency for hospital waivers. So we need to sit down through the regulations and the policy for waivers that will come here. First of all, we have a formally established committee, well constituted, that will be dealing with waiver. We give them TOR, or terms of reference, on how who is supposed to get the waiver, how it should be given, at what percentage. Sometimes you get somebody getting 80,000, another one getting 200, another depending on the goodwill of the committee that was sitting on that day. Maybe we need to have a very clear formulation of a policy on waiver. And then we make sure that after the hospital has provided this waiver, they can decut this money somewhere, because we want them to sustain the services for the hospital. You can see they have a cash crunch. We had a 44% and a budgetary funding, So if they gave waiver, the OSR that they are able to generate, or the income they are able to generate, is less. So on waiver is a matter that we should take home, even as this assembly, as a committee budget and others. We make sure that we have a waiver policy and regulation in the JM hospital, and even the engineer hospital. The other issue I want to say is that, Honorable Speaker, when we read the audit report for the county, I would like to know where these 70 million. You know they have a pending bill of 70 million. And I am aware that we provided money before the onset of FIF. We provided money which we used to call hospital transfers. And JM Hospital was supposed to receive into extent of 70 million. In terms, and that is, they did not budget what they did not have. They budgeted money that they were promised within the budget that they are going to receive 70 million as part of county shareable, county hospital transfer. According, and I would like the audit, the big pack to go and look at that matter, because I want to raise it somewhere else. Because now we are dealing with JM and we are dealing with what they received. So we cannot talk of what they did not receive. But that money, if you go to the controller of budget report, the financial report, you realize that that money was requisitioned. But when you go to the books of account for JM, it was not received. And I know this is a matter that you have dealt at the health committee. At one particular time, we would want to know, when this money was requisitioned, 70 million that was supposed to be hospital transfer, where did this money go? Because that is why we created the pending bill for 70 million for JM Hospital. That is a matter, when times come, we would like to ask and know. And that is a matter that we will not stop until we are able to know. And I am able to follow this, and I'm saying authoritatively as the chairman budget, because I'm aware of this issue. Honorable Speaker, the other issue that I want to raise is that we do audit reports so that we can keep improving for our future. So when we have issues that are unresolved from prior audit issues, we need to ask ourselves whether they are consuming the audit report. This report, as much as this assembly consume, the person who is supposed to benefit. Sometimes we see audit report as a condemnation, but it's a wake-up call. We are being told as an institution, you have a gap here that you need to improve on. That is why they are done year after year. So it is not a condemnation that you have been judged. You should make sure that from this report, you are able to improve for the future. So when we have unresolved prior audit issues, it tells us that JM somewhere they are not taking the audit reports very seriously. Because when we talk of unsupported employee costs, this is an issue they should have resolved. The issue of inventory, as Honorable Stephen is talking about, is an issue they should have resolved. So the issue we are expecting in the next year's report, they will have resolved on these issues, because they have been raised in this audit report. So, Honorable Speaker, for me, I would say the greatest power that has been vested on this assembly is the power of oversight. And questions should be asked, and we should keep asking and asking and asking and preparing the executive until we reach that point where we can become a model county where people should come and benchmark. Thank you, Honorable Speaker.
You may proceed and call the mover.
Thank you, Honorable Speaker. I call the mover.
Thank you, Honorable Speaker. I'm one person who believes health is wealth. Mr. Speaker, JM Hospital is the biggest hospital we have in Nyandarua, Mr. Speaker, and it's only important that we get it right there so that when our people need services, they can get them. Mr. Speaker, the committee gave recommendations, and it's only important as we move forward as a house because it touches the health committee and maybe other committees, the pick-back committee, Mr. Speaker. It is important that we follow up. We've given the dates. It's only important we follow it if the department will follow the dates that we have given them to have maybe have established the policies that are needed to take care of maybe the others that are in the MEM and all the others, Mr. Speaker. Thank you so much, Mr. Speaker. And I move.
I now put the question, which is that this House does adopt the report of the Committee on County Public Accounts and Investments Committee on the report of the Office of the Auditor General on the JM Kariuki Memorial Hospital for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House. May those of a similar opinion say aye. May those of a contrary opinion say nay, and the ayes have it. Honorable members, we may proceed to the supplementary order paper. Clerk, next order.
Following your directions, Mr. Speaker, sir, we proceed to the supplementary order paper. Order number 1, administration of oath. Order number 2, communication from the chair.
No communication from the chair.
Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, statements. Order number 8, motions and bills. Mr. Speaker, sir, we have a motion that is a continuation of debate to be moved by Honorable Duncan Githinji Chege, Chairperson, Committee on County Public Accounts and Investments.
Honorable members, this motion was being debated and there were some assertions by some members of the committee that the report which formed the foundation of the motion was not the report adopted by the committee. Chairperson, Honorable Duncan Githinji Chege, what do you have to say?
Thank you very much, Mr. Speaker. But, Mr. Speaker, just allow me to delegate this to Honorable Juliana Babu. Mr. Speaker.
Honorable Juliana Babu Mugore, proceed.
Thank you very much, Mr. Speaker. I want to take this opportunity to request the House, pursuant to Standing Order 62, to allow the committee withdraw the motion that this House does adopt the report of the Committee on the County Public Accounts and Investments on the report of the Office of the Auditor General Nyandarua Climate Change Fund for the year ended 30th June 2025 as a report of the House and the recommendation therein as the resolution of the House. And subsequently, Mr. Speaker, withdraw the report of the Committee on the Auditor General of Nyandarua Climate Change Fund for the year ending 30th June 2025 due to some issues that arose during the debate on the adoption of the motion in the morning sitting. Mr. Speaker, further, I beg that to seek leave of this House to table a new report of the Committee on the County Public Accounts and Investment on the report as you direct, Mr. Speaker. I request.
You may call the mover, the seconder.
I would want to call Honorable Lucy to help me do that. Second.
Honorable Lucy Kidinji.
Thank you, Mr. Speaker. Maybe I was not around in the morning, but as Juliana stated this, we need to go back as a house and put our house in order so that maybe we can table the right report that we adopted. Thank you, Mr. Speaker. And I second.
I propose the question that pursuant to Standing Order 62, this House does grant leave to withdraw the motion that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Nyandarua Climate Change Fund for the year ended 30th June 2025 as a report of the House, and the recommendations therein as the resolutions of the House, and subsequently withdraw the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on Nyandarua Climate Change Fund for the year ended 30th June 2025 due to some issues that arose during the debate on the adoption of the motion during the morning sitting. Further, the Committee on County Public Accounts and Investments be allowed to table a new report of the Committee on County Public Accounts and Investment on the report of the House Office of the Auditor General on the Nyandarua Climate Change Fund for the year ended 30th June 2025. Honorable Steve Matimo.
Mr. Speaker, I want to agree with this particular recommendation, and I want to thank the Honorable Member from Magumu, Honorable Mohende Kariuki, for raising that pertinent issue, because, Mr. Speaker, we already in receipt of the good report that the committee had had. I don't want to preempt debate, but Mr. Speaker, looking at whatever is there Mr. Speaker, of maybe before it's tabled, it's a good report. So I really support the same, and I pray that the same will be tabled, and Mr. Speaker, we shall be able to compare, and with that, I support.
What is it, Honorable Lucy Kidiji?
Mr. Speaker, I don't think Honorable Murithi is in order to purport to have seen a report that has not been tabled in this committee, unless he tells us maybe there's something that he does behind us that we are not aware. Or maybe he tells us if he's the clerk that is prior to the information that maybe this House doesn't know.
Honorable Matimu, you are out of order. As the report is not tabled, and even if you are privy to the information, you may have attended the committee meeting, which is your right, but the material information you are giving to the House is irrelevant. You may proceed, Honorable Matimo, and call the mover to respond.
Mr. Speaker, with your guidance, I will wait until tomorrow and compare, and with that, I call the mover.
Proceed, Honorable
Thank
Juliana.
Thank you, Mr. Speaker. I honestly want to take this opportunity and appreciate the House for understanding that small hiccup we had in the morning. You know, man is to error, and we are dealing with quite a number of reports. And the recommendations that were highlighted in that report may have been a mistake or, just a system error that will fully be rectified when we provide the report. Thank you, Mr. Speaker. I move.
I now put the question, which is that, pursuant to Standing Order 62, this House does grant leave to withdraw the motion that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Nyandarua Climate Change Fund for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House, and subsequently withdraw the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Nyandarua County Climate Change Fund for the year ended 30th June 2025 due to some issues that arose during the debate on the adoption of the motion during the morning sitting. Further, the Committee on County Public Accounts and Investment be allowed to table a new report of the Committee on County Public Accounts and Investment on the report of the Office of the Auditor General on the Nyandarua Climate Change Fund for the year ended 30th June 2025. May those of a similar opinion say aye. May those of a contrary opinion say nay. And the ayes have it. Honorable members, taking note of the motion moved by Honorable Duncan Chege, Chairperson Committee on County Public Accounts and Investment, and the subsequent leave granted by this House, I direct that the aforementioned report be processed through a supplementary order paper upon conclusion of the business in this supplementary order paper. Honorable members.
Mr. Speaker, sir.
What is it, Honorable Stephen Matima?
I was, maybe through your director, Mr. Speaker, I really get the timelines that you've given for the same to be tabled.
Honorable Matimo, your worries are well cared for. Therefore, we proceed. Honorable members, I now direct that we move to the supplementary order paper. We proceed with the businesses in the same supplementary order paper. Next.
Under the same order, Mr. Speaker, there is a procedural motion by Honorable Duncan Chege, the Chairperson, Committee on Public Accounts and Investment.
Honorable Duncan Chege, Honorable Juliana Babu Mugure, proceed.
Thank you, Mr. Speaker. I beg to move that pursuant to Standing Order 233, Mr. Speaker, that the House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Nyandarua County Executive, the year ending 30th June 2025, as a report of the House and the recommendation therein, and request, Mr. Speaker, that it be exempted from requirement of Standing Order 55B that requires a notice motion to be given at least 1 day before the motion appears. I call Honorable my chair to second.
Thank you, Mr. Speaker, and I do second. Thank you.
I propose the question, which is that, pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Nyandarua County Executive, State and Public Officer, Car Loan and Mortgage Scheme Fund for the year ended 30th June 2025 as a report of the House and the recommendations therein, as the resolutions of the House, be exempted from the requirements of the Standing Order 55B that requires a notice of motion be given at least 1 day before the motion appears on the order paper. I now put the question that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Nyandarua County Executive, State and Public Officer Car Loan and Mortgage Scheme Fund for the year ended 30th June 2025 as a report of the House, and the recommendations therein as the resolutions of the House, be exempted from the requirements of the Standing Order 55B that requires a notice of motion be given at least 1 day before the motion appears on the order paper. May those of a similar opinion say aye. Aye. May those of a contrary opinion say nay. And the ayes have it. Clerk.
Under the same order, Mr. Speaker, there is a substantive motion by Honorable Duncan Gideji Chege, the Chairperson, Committee on Public Accounts and Investment.
Honorable Juliana Babu Mugure, you may proceed.
Thank you, Mr. Speaker. I want to take this opportunity to move the report on the Auditor General Financial Operations of the County Executive on the Car Loan and Mortgage Fund for the year ending 30th June 2025, and take this opportunity, Mr. Speaker, it is the committee of the PICPAC Committee as read out by the Honorable Chair, and take the opportunity to appreciate the Office of the Speaker for facilitating us, Mr. Speaker, to be able to do these reports and present them on time. And also to note, Mr. Speaker, that the Auditor General is established under the Article 229 of the Constitution, reading through Article 229.5, 229.8 that establishes the mandate of the Auditor General, and go straight to the query, Mr. Speaker. We developed a methodology on how we executed the report writing. We received the team from executive, and I also want to appreciate the department for showing up to answer to our concerns and deliver submissions in respect to this, to the queries raised, Mr. Speaker. And among the observations that we made, Mr. Speaker, is that the report received a qualified opinion on the financial statement, and the qualifications rose from concerns relating to doubtful receivable from the exchange transactions and unresolved prior year. We went ahead, Mr. Speaker, to dig further on the query and realized that the Auditor General had reported that the statement of the financial position reflected current receivable from exchange transaction amounting to 71,908,982 Kenya shillings, and non-current receivables amounting to 522,276,230 Kenya shillings, totaling to amounts of 594,185,212 Kenya shillings. Included in this amount, Mr. Speaker, was the 11,585,281 Kenya shillings in respect of outstanding loans owned by 3 former executive committee members who were defaulted on loan payments, and the recovery of those debts were doubtful since no provision had been made in financial statement, and the Fund Administration Committee had not repossessed the secured property or taken recovery measure, Mr. Speaker. Subsequently, The accuracy and the recoverability of the amounts could not be confirmed, Mr. Speaker. We went through the management response from the executive and noted that the case had been determined in court by favor of the 3 officers who were supposed to be compensated 25,286,536 Kenya shillings, and the management indicated that the amount were owed to the fund were Kenya shillings 12,081,067 shillings had been deducted from the compensation payable to them and will be remitted directly to their fund account. And the amount had already been requisitioned for payment, Mr. Speaker. Mr. Speaker, the committee also observed that the explanation provided by the management, the outstanding loan balances would be recovered from the compensation payable to former officers. The committee also noted that supporting documents, including requisition forms and payment vouchers, had been submitted as evidence of the recovery process. However, Mr. Speaker, the committee observed that the commitment by the management to complete the recovery by 28th February 2026 had already lapsed, raising concerns as whether the funds had indeed been remitted to the funds account. In absence of confirmation of payment, the loan may be deemed to remain in default, Mr. Speaker. The committee observed that the delay in recovering the outstanding loans and the failure to provide for doubtful debts in the financial statement points to weaknesses in debt management and financial reporting within the fund. Mr. Speaker, the committee recommended that the finance should ensure that the requisitioned amount is processed and remitted to the fund accounts within 30 days of the adoption of this report. Recommended also that the Fund Management Committee should strengthen the loan monitoring and recovery mechanism to ensure prompt recovery of the outstanding loan balances and prevent future defaults. The committee recommended further that the administration should ensure appropriate provisions for doubtful debts are made in financial statement in accordance with the applicable financial reporting standard. Mr. Speaker, we also encountered and resolved matters, from other previous years, issues to do with non-performing loans, outstanding receivable from exchequer transactions, and a lack of risk management and fraud policy. And Mr. Speaker, to resolve these matters was an indication of weakened accountability and governance, as well as non-compliance with the provisions of the Public Audit Act. Mr. Speaker, we also read through the management responses from the executive, and they explained to the committee the members who case determination had been pending in court. Following determination of the case, and the loans will fully be repaid from the compensation payable before 28th February 2026, and the requisitions had already been made. We also received management responses on outstanding receivable from exchange, and the interest will also be deducted from the compensation payable to them. However, Mr. Speaker, the committee observed that the interest was charged on the loan during the period when the matter was under judicial determination, which may not be justified given that the court ultimately ruled in favor of the officers. Mr. Speaker, they also noted that they are in the process of bringing the risk management policy and fraud policy to the House. Mr. Speaker, the committee observed further that the unresolved prior year issues largely related to loans advanced to 3 former county executive committee member. The committee further noted the management committees that both the principal loan amount and accrued interest will be recovered from the compensation payable to officers. The committee acknowledged the Fund Management Committee had since developed a risk management policy, and will soon be provided to the House for approval. The committee recommended on this, Mr. Speaker, that they ensure that prior audit issues are well resolved. Mr. Speaker, the committee concluded that the Fund Management Committee implements the recommendations contained in this report and ensures strict adherence to the relevant legal and regulatories from framework governing the management of public funds. This will ensure transparency, accountability, and effective management of the fund. Thank you, Mr. Speaker. I wish to again call the Honorable Chair to second. Thank you.
Thank you, Mr. Speaker. And I do second, Mr. Speaker.
The motion is duly moved and seconded. I therefore propose the question, which is that pursuant to Standing Order 236, the motion that this House does adopt the report of the Committee on Public, I now propose the question, which is that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Nyandarua County Executive, State and Public Officer Car Loan and Mortgage Scheme Fund for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House. Honorable Isaac Kungo.
Honorable Speaker, again I want to thank them. I know they are overwhelmed. I'm also overwhelmed because I was reading something here and there was a typo error somewhere. I have seen somewhere they have talked of Nyandarua's page. According to this is page 10. Mr. Speaker, the Auditor General examined the financial statement for the Nyandarua's for the stated 3 financial year and gave adverse opinion. I don't know the relationship between Nyandarua's and mortgage and Karun. So there was some confusion there that need to be corrected. Honorable Speaker, I think it is important, Chairman, to note that we need some correction on that point of it. But that notwithstanding, Honorable Speaker, there is a very serious issue that is coming out from this audit. The issue of 13 million. Actually, because I'm the budget chair, I know we provided 13 million. This is as a result of the case of the CCEs that were stopped by the second regime during Honorable Kimemia, the 3 of them. I think there are 3 of them, and we went to court, and they won the case, and they were supposed to be compensated. And we are all aware that they had taken mortgage. And as a result of the ongoing case, they were not paying the mortgage because they felt that they were dismissed illegally. And Honorable Speaker, one thing that we noted is that after they were compensated, also the county was pushing them to recover for the mortgage. So essentially what was supposed to be done is for the county to go and recover the properties that were used as collateral for these mortgages. When we received the information, we, as a budget committee, we had a win-win situation and a discussion. The resources were not available because we were supposed to pay around 25 million to the CCMs after they had won the case. But by then, we did not have available resources to pay the 25 million. So we had a discussion with the county attorney, together with the CCMs, and we agreed we provide 13 million first, so that that money will not be paid to the CCMs. That money will go to what they had taken as mortgage, so that the mortgage will be cleared, and now we will have a deficit to pay in lieu to the CCM according to the court ruling on how much they were supposed to compensate, which was 25 million. And as budget committee, we did that. We provide that money. Now what I want to know, because from this report it is not clear, whether that money was requisitioned and deposited into the special purpose account for the mortgage, the car and mortgage, for the staff, for the executive. From this report, Honorable Speaker, Chairman, it is not clear. Actually, the auditor is raising a pertinent issue. He's saying that that money was included as a receivable, but when he audited, it was not received. So in the explanation, they are saying that the executive was in the process. This is a money that you just requisition and you put it in the special purpose account to be available to the members of the staff so that they can take mortgages and loans there. This is a very serious issue that requires further, and I request further investigation. Because if you don't investigate on it right now, we will never know. You know, within the fund, you can go and scrap the debt. You know, for those who now, you can go and scrap the debt and say they have cleared. But the Auditor General is saying we cannot be able to show we recovered. So this money might be requisitioned. Instead of going to the account for the mortgage, it goes elsewhere and we scrap the debt. I don't know whether members are getting what I'm saying. Because now the debtors, the CCM will be told now, go come and take your titles, come and take your log books, you have been cleared, the government have paid. But then, did this money go to the special purpose account for the loans and mortgage for the staff? That remains an unanswered question that requires to be answered. And I think the auditor has raised that issue. You know, sometimes the auditor doesn't have a lot of time. It is now cause for this House, led by Honorable Keriga, the chair for special funds, to investigate further now because he has ample time, to ask the executive to show us the deposits, to make sure that that money did to the special purpose account for the cars and mortgage. Otherwise, if we don't know that, if we don't follow up on that, we might, in this exchange, we lose money. The other issue is that I have noted with a lot of concern that the cumulative figure for the fund is around 522,276,000. This fund is over 10 years. And every year, Honorable Speaker, we have never given anything short of 70 million. So if I'm doing simple calculation, within over 10 years or 13 years, we should be exceeding 800 million when it comes to the total fund. So I also put a lot of questions on that part. We needed to know what is the portfolio for this fund. Because every year we provide over 70 million for the executive. And the Honorable Speaker, as I see it, this is a very serious and very serious concern for the staff. Remember, this is a welfare issue. And we are providing this money so that our staff can be able to get affordable loans to be able to buy houses or build houses and be able to purchase vehicles. It is a welfare issue. And so, with the number of the staff that we have in Nyandarua, we are talking of 2,800. They are members of this executive that will go into retirement without accessing this welfare, if we are not seriously looking at the management of this money. So I also ask again that we need to investigate by now, because this is money that accumulates interest. It is a money that we keep building on that fund year in, year out. We get to know what is the real portfolio for this fund, so that we can also know that maybe somebody who was employed on 2013, who doesn't live for 20, 40 years in this county, and by the end of the day, you don't receive the benefit for the mortgage. So, Honorable Speaker, once again, thank you, the committee, but still the issue of concern still remains. Thank you, Honorable Speaker.
Honorable Joyce Munywa.
Thank you, Mr. Speaker. I also want to thank the committee for the good work that they have done, the Committee of PICPAC, on being able to bring up the issues as raised by the Auditor General. And as a member of the Special Funds Committee, I note the same issue that Honorable Kongo has raised is one of the recommendations that we have been doing year in, out, following up on that specific amount that was intended to have been returned to the fund so that members are able to benefit. And for me, maybe the issue that is also coming up is when we talk about recommendations, even what we are calling here, unresolved prior year audit matters. These issues, when we raise recommendations, the follow-up and actualizing and ensuring that what has been raised by the Assembly is really actually acted upon is one of the things that really needs to come up, so that if that matter, especially on that on the fund, the 12 million had been actualized, the auditor would not have to have raised this. But I know it's a matter they keep on saying they have done the requisition. It has not yet come up. So as the chair budget has said, it is a matter that the committee is on top of things. And I know we'll be even bringing a report. I know that's still a matter that will come up. Thank you, Mr. Speaker.
Honorable Majority Leader.
Point of information.
What is it, Honorable Kung?
Maybe when they are looking at that matter, Honorable Joyce have raised, I would like to give her information that in the financial year 2025-2026, the budget committee under the county attorney, that is the county attorney, we did put money in the name of pending bills. And we said, this is the decreto sum to former county employee Faith Bogwa, Rose Wamoya, and Simon Nganga, to offset mortgage principal and interest owed. Because I've seen the issue of interest, Honorable Member, talking about the issue of interest, that it was not attainable because the matter was put into the members. But this is that is why it is 13 million. It is not even 11 million. We are saying we did put that money to offset mortgage principal and interest owed to the county government. And then we indicated pay into mortgage fund account 13 million.
Well noted. Honorable Regional
thank you.
Majority Leader.
Thank you, Honorable Speaker. Honorable Speaker, I'm happy with the report from the committee because, Honorable Speaker, you know, we have had on different audit reports, but I also tend to agree with the auditors that they were able to qualify the observation, that is, they gave a qualified opinion on this. Honorable Speaker, indeed, it has, when Honorable Kongo has lost to explain further on what transpired during the last financial year, it has brought a lot of confusion now. Because when we go by what has been stated here, is that we were to recover, to get the outstanding receivables from members, from what we gave the members. But from the report, which is coming up from Honorable Kongo, is that through the audit committee, through budget committee, we were able to provide that amount, which ought to have been submitted to the relevant account. Then this one now informs us that we need to get deeper to see whether that money was submitted or not. Honorable Speaker, there is also this issue of non-performing loans. I am also getting concerned because the way they are reporting from this report is that substantively you cannot be able to say authentically this is the amount that is owed in non-performing loans. Honorable Speaker, we have what we call odious debt, whereby if loans are not performing, it is better to remove them from the books of accounts other than just registering them year now, year then. and there is no way that we'll be able to maybe to recover the said loans. So in terms of financial reporting standards, I think they need also to improve. I am happy because as reported, when this audit report was being done, I've taken note that by then there was an issue of lack of risk management and fraud policies. But I'm happy because from the response from the management is that the risk management and fraud policy has now been developed and approved by the FAD Management Committee. Indeed, we have totally observed some of these FADs in different areas, and if there is no proper guidance on policies, for sure they don't go far. There is what we call fraud. Mostly you'll get that there will be room for fraud if you don't have a very specific risk management and fraud policy. So having this in within the FAD Management Committee will totally help us or help the committee to be able to manage this FAD. I'm happy. This is one of the reports that I can say I'm satisfied with, and we are looking forward to see other audit reports which will have a qualified opinion in different sectors within the county. Thank you so much. I totally support.
Honorable Stephen Matimu Muridi.
Mine will be very brief, Mr. Speaker, sir. And it's on an issue that has regard on almost all the audit reports that we've received today. And this is on policy, on fraud, Mr. Speaker. I think we should have timelines to ensure that we have this policy in place, because in the previous report that we've just had, it is an issue that was there, that what is lacking in our county, even in the report that we had for JM, is the fraud policy. So I think just the same thing, or the same way that the committee has recommended, I think it's very much in order that within 14 days, we have a policy in place before this house, and should be a policy that will cover all departments in our county. And with that, I think we shall have cured one of the issues that has been occurring in each and every audit report. With that, Mr. Speaker, I call them over.
Honorable Bob Juliana.
Thank you so much, Mr. Speaker. I want to take this opportunity to appreciate the members for their contribution and draw the honorable members to the report, their attention to page number 12, where we have made a recommendation that the department ensures that the requisitioned amount is processed and remitted in the fund accounts within 30 days of the adoption of this report. So in the next 1 month, all the issues that have been raised on the floor, we will receive the way forward from the departments and make sure that everything that was raised, even at the interrogation level with the committee and the executive, that is that is done, Mr. Speaker. And we can, the honorable members can always, they're always invited to sit in attendance in the committee of PICPAC in the next month, so that we can, we can just confirm to you that some of the issues that you were raised were followed up and all of them implemented accordingly. Thank you, Mr. Speaker. I therefore move.
Thank you. I now put the question, which is that this House does adopt the report of the Committee on County Public Accounts and Investment Committee on the report of the Office of the Auditor General on the Nyandarua County Executive, State and Public Officer Car Loan and Mortgage Scheme Fund for the year ended 30th June 2025 as a report of the House and the recommendations therein as the resolutions of the House. May those of a similar opinion say aye. May those of a contrary opinion say nay. And the ayes have it. Honorable members, I now direct that we proceed with the second supplementary order paper. Clerk, next order.
Mr. Speaker, sir, with your directions, proceed to the supplementary.
In the afternoon sitting tomorrow, Wednesday, 11th March 2026. Next order.
Order number 7, statements. Order number 8, motions and bills. Mr. Speaker, sir, we have exhausted the business as appearing in today's main and supplementary order papers.
Honorable members, there being no other business to transact during this sitting, I now adjourn the House to Wednesday, the 11th day of March 2026 at 9:30 a.m.
Our best. Our best.